It's time to do a bit of simple math. There are about 35 million of us here in Canada. Most of us are relatively healthy most of the time. And when we're not, a huge percentage of the things that are wrong with us are important to us, but they're not life-threatening. Fevers and flu, and cuts and bruises and ear infections, and even chronic illnesses like diabetes. Sometimes we need to talk about or change the medicine we're taking. Sometimes we just need to talk to a healthcare provider and be reassured. When you think about 35 million people and their illnesses and aches and pains and questions and worries, it's pretty clear how it puts enormous strain on our healthcare system. And when you factor in that there are almost 5 million of us with no primary healthcare provider at all, it's pretty easy to see why your local hospital emergency department is getting really crowded. Well, here's another number worth looking at. There are about 3,000 nurse practitioners in Canada. And the point of this little story is that they could really be an answer to the problems we're facing. Nurse practitioners are, well, nurses, and that means they have a very special way of caring for people. With advanced education, training, and experience, nurse practitioners can manage chronic illnesses like diabetes, order diagnostic tests, write prescriptions, and a whole lot more. So, if we gave nurse practitioners a chance to make a difference, imagine what they could do. For starters, nurse practitioners could help practically every one of us folks who are waiting for someone to provide health care. And the care we'd get would be excellent. And the addition of more nurse practitioners to the Canadian healthcare equation would give some other amazing benefits too. Shorter wait times, 30 million of us getting more access to the care we need. Millions more of us finally finding someone to look after us. And 35,000 overworked Canadian family doctors would see a huge amount of pressure taken off them, allowing them to focus on acute and complex cases. See how the numbers add up? Do you see how adding more nurse practitioners into our equation is going to look even smarter? Pretty simple math, isn't it? Talk to your elected representatives. Go to npnow.ca to find out how to do it. Nurse practitioners. It's about time.